With retinitis pigmentosa, you lose your peripheral vision gradually.
When you lose something that you rely on so much, and then you're thrown into darkness, like I was, and then to be able to have a device come along that helps you see certain things, that helps make your life a little more tolerable.
The device they are referring to is the Argus Retinal Prosthesis, a recent technological breakthrough in biomedicine. Meet Dr. Mark Humayun, the inventor of the device. While still in medical school at Duke University, Mark was inspired by the success of the cochlear implant for the hearing impaired and wondered if the same principles would work for the more complex sense of eyesight.
Well, my path towards this, where I am now, wasn't clearly connected. It wasn't even clearly thought out. I was interested in doing neurosurgery. I wasn't interested in doing engineering. I wasn't interested in ophthalmology, but my grandmother went blind from diabetes as I was in medical school, and really made me focus towards the eye, in particular restoration of vision to the blind.
One of the biggest challenges was overcoming those early hurdles and demonstrating step by step that yes, in fact, it can work. Yes. And we didn't know either in the early days. I mean, when we started, it wasn't obvious 20 years ago that this would work.
Our eye works on tiny electrical pulses. So when light hits the retina, it converts it into these tiny electrical pulses. But the cells that do it, the rods and cones, the light sensing cells, are damaged in millions of patients. And so what we're doing is developing electrical implant that, under controlled electrical stimulation, basically jump starts and provides those tiny electrical pulses. So that's how this device starts, and when those pulses are sent to the brain via the nerve, the brain starts to interpret it as spots of light, and when it puts them together, much like a pixel screen on your camera or elsewhere, the image starts to come together.
This is how the blind see a face. But remarkable things happen when disciplines unite. USC doctor and engineer Mark Humayun and a team of leading labs and universities are implanting artificial retinas, enabling the blind to detect light, perceive motion, and one day see what they've only felt for so long. A triumph for mankind.
I've always loved you in a tie.
From the Research University of the 21st Century.
Because these axons going to the brain, the nerve fibers going to the brain, hadn't been used in the case of his first patient in more than 50 years, you just wondered, how could this possibly work?
When we took our very first patient, Mr. Churchey, and we put an electrode in his eye for the first time for a short period, we had no idea whether this was going to work.
He was the first one to volunteer for that test, which was a heroic test. He was awake in the operating room under local anesthesia with a wire in his eye, and we were asking him what he saw.
And he started to see a spot of light. I mean, that was amazing. It was really, I mean, I can't put it in words. Even to this day, I think about it, it gives me goosebumps.
And we asked Harold, so what do you see? And he started, there was dead silence, so you could hear a pin drop, and he started shaking his head. And everybody, you could hear the air flow out of the room. We said, it didn't work. After all that, this was probably 10 years into the research, and it didn't work. And then he says to us, all I see is a line that goes like this and a line that goes like that. And so it was an L. And so he said, my gosh, yeah. Harold, it's an L. He said, yeah, this looks like an L. And so he was, it's not, I never went back and asked him, what were you expecting to see? But we were ecstatic.
The retinal implant has definitely been a plus for me. And if in the future they come up with a device that would help me to be able to see and to help other blind people be able to see, it would be wonderful. It would be a blessing in the future.
This project is truly interdisciplinary. It requires surgeons, engineers, physicists, chemists, you name it. It requires a large group of scientists and engineers to be involved, and physicians. So we've had the benefit of working with top-notch universities. I'm at the University of Southern California at the Doheny Eye Institute here, but we work with California Institute of Technology, Caltech. We've worked at University of California, Santa Barbara, University of California, Santa Cruz. We've also worked at, East Coast. We continue to work at the school where I was, Johns Hopkins Hospital, and Duke University to some extent, and Columbia University in New York, and University of California, San Francisco. So we really work with a lot of universities, but we also work with national labs, and that's been key.
And what Mark's been able to do is what the federal government says it wants, how to get different agencies to work together. Notably, he's got this major grant from the National Science Foundation, another large grant from the Department of Energy, and yet further support in collaboration with a company from the National Institutes of Health. So they all have different components. I think it's very impressive that Mark's been able to pull this group together.
Los Alamos National Lab, Lawrence Livermore National Lab, Sandia National Lab, Oak Ridge National Lab, Argonne National Lab. National labs have wonderful technology that has certainly helped us. So it's really a combination of universities, these national labs, and also the industrial partner Second Sight Medical Products, who's ultimately making, manufacturing, and selling these products.
In Second Sight's Argus II retinal prosthesis system, a miniature video camera in the eyeglasses captures the scene. The video is processed by a small portable unit and transformed into instructions which are sent back to the glasses. These instructions are then transmitted wirelessly to the implant on the eye. The implant consists of a receiver and an array of electrodes. Instructions are received and corresponding signals sent to the array, which emits small pulses of electricity. These pulses stimulate the retina's remaining cells and are transmitted down the optic nerve, conveying visual information to the brain, which perceives patterns of light. Patients learn to interpret these visual patterns.
Fireworks was another big moment for me, to be able to see, look up into the black sky and see the fireworks. I couldn't see the color of them, but I could see all the flashes, and I could see the flashes falling. And just remember staring at it thinking, I can't believe I'm seeing this. I can't really believe that I am seeing those flashes fall.
And it would be my hope that Mark is able to achieve his dream as he's gone from initially 16 microelectrodes to 60. He now has some that are available for testing that are over 200. But if he gets to the 1,000, then people are able to see faces, they're able to read. I mean, just how exciting is that? Remember, these are people who are blind to have lost their photoreceptors. It's mind-boggling what Mark has achieved.
Like I said, I have to scan my head back and forth to keep getting the flash of the edge of the grass and be able to get it. I don't always know what things are, but I can kind of determine if it's a tree or a sign or bushes.
Mark, to me, has just opened the door. I mean, yes, biomedical engineering has been an important discipline for decades, and what it's done to help people with pacemakers and extend life is just fantastic. And quality of life is what it's all about. But what Mark brings to the table
is really what the great frontier is. And to me, the great frontier is the human brain. And that's the greatest computer. It's the greatest unsolved mystery that we have in the entire universe, at least from my perspective.
Well, I think biomedical engineering, as it applies to interfacing devices, bioelectronics with the human body is a very exciting field. You know, we can do it in terms of neuromodulation, which is really affecting these neurons where there are no nerve cells and providing input like we've been talking about for the retinal implant, for cochlear implants, we've heard about that. Deep brain stimulation for Parkinson's is another very interesting application. As one of my patients said, you know, often there's this question about, well, I mean, when we put these devices in, you know, are we making our patients more machine-like or not? And my patient said it very well. He said, you know, at the end of the day, this device has made me more human. I was at one time able to do some of these things, interact with my family, and now this device allows me to do some of those things again.
And there I was looking up at the ceiling, and it flipped on the switch, and there it was. I was looking right up at it, and I could see that light. And I turned it off, and I turned it back on again. I went to do that about 3 or 4 times. And the more I did that, the more emotional. And the day that we had the experiment at Silmar, when I got home, from seeing that door the way I did, the experiment, mobility experiment, I called my wife and all my kids over, and I sat them down. And I told them, I said, this is what I saw today. Well, I wasn't the only one in the living room that wasn't, they were all crying. Everybody got emotional because they know, for me, it was a big thing for me.